Can acoustic trauma cause sudden or permanent hearing loss? Imagine standing near a loud explosion or a gunshot and suddenly feeling your ears fill with a ringing or a muffled sound. That's because acoustic trauma can cause both sudden and permanent hearing loss. Acoustic trauma happens when your ears are exposed to extremely loud noises, usually above 120 to 140 decibels. These sounds include fireworks, gunfire, explosions, or industrial accidents. The intense noise can damage the tiny hair cells inside the cochlea, which are essential for converting sound waves into signals your brain understands. It can also rupture the eardrum or injure the small bones in the middle ear, leading to immediate hearing problems. If you experience sudden hearing loss right after a loud noise, it's called acute acoustic trauma. This can happen instantly after a single loud event, like a blast wave from an explosion or a gunshot. Along with hearing loss, you might notice ringing in your ears, called tinnitus, or a feeling of fullness or pressure in the ear. This sudden loss can be quite alarming and often requires prompt medical attention. Permanent hearing loss can develop if the damage to the hair cells or nerve fibers in the inner ear is severe enough. Since these cells do not regenerate, the damage is usually irreversible. This type of hearing loss is called sensorineural hearing loss and is common in cases of severe acoustic trauma. Studies show that military personnel exposed to blast injuries have a higher risk of permanent hearing damage, with more than 60% experiencing some level of hearing loss from such incidents. In some cases, acoustic trauma can also cause conductive hearing loss, which involves damage to the eardrum or the ossicles. This type of hearing loss might be temporary if the injury is mild or permanent if the damage is severe. It's important to understand that acoustic trauma is a specific form of noise-induced hearing loss caused by a sudden loud noise, unlike gradual hearing loss from prolonged exposure to loud sounds. Both types damage the inner ear hair cells, but acoustic trauma usually results in a quick onset of hearing problems. To protect your hearing, it's crucial to wear ear protection in environments with loud noises, like shooting ranges, construction sites, or fireworks displays. If you experience sudden hearing loss after loud noise exposure, seek medical help immediately. An audiologist or healthcare professional can assess the damage and discuss potential treatment options. In summary, yes, acoustic trauma can cause sudden hearing loss, and if the damage is significant, it can lead to permanent hearing impairment. This underscores the importance of protecting your ears from loud noises and seeking prompt medical care if you notice any sudden changes in hearing after exposure. Always remember that individual responses can vary, so consulting a healthcare professional for personalized advice is essential.